Hello, I'm Dr. Harris Klear, and I'm going to talk about the clinical uses of lasers. And my affiliations are past resident selection committee from Cooper Hospital, Board of Visitors of Temple University School of Podiatric Medicine, past president of Temple University School of Podiatric Medicine Alumni Association, from 2014 to 2016, and a member of the alumni for the past 20 years. And I'm a consultant for Burman Medical Lasers. The disclosure is that I have a private practice which engages Burman Medical Lasers to arrive at my office on a per-patient mobile laser company basis to treat patients for pain, inflammation, wounds, warts, ulcers, neuropathy, fungal nails. I am a consultant for Burman Medical Lasers, LLC. The latest use of lasers for physicians and the objectives are identity of various podiatric conditions which therapeutic diode lasers can treat efficaciously with sustained results. Demonstrate images of actual patients depicting before, during, and after results. Explain why and how therapeutic diode lasers enable sustained results across a spectrum of patients. Describe why therapeutic diode lasers were utilized to treat the patients and the duration of the treatment or treatments to bring conditions to resolution. Develop comfort level with therapeutic diode lasers efficiently, then comfortably expand into additional conditions. My agenda is to explain how we treat wounds, ulcers, warts, pain, inflammation, neuropathy, fungal nails, and more. And these are case studies of my actual patients utilizing the therapeutic diode laser. And this is my CV. And the biological effects of the laser in detail include anti-inflammatory, analgesic, accelerated tissue repair and cell growth, immunoregulation, improved nerve function, improved vascular activity, increased metabolic activity, reduced fibrous scar formation such as scars, and trigger points and acupuncture points. As you can see, the tissue that the laser penetrates goes through the skin and down to the bone. And the picture on the right depicts a hand with the laser beam on it, and you can see the vasculature of the hand. The first case study is an 83-year-old female, type 2 diabetic with neuropathy, presented 18+ month of chronic ulceration at the head of the first metatarsal of her left foot. She had gone to a wound care center, and they recommended hyperbaric chamber with oxygen for 3 months every day for 2 hours. The patient was not a candidate for hyperbaric chamber. Laser therapy was presented as an option to this patient. So you can see the wound at the present state prior to treatment. 6 days later, you can see the hyperkeratoses that form surrounding the ulceration plus maceration from the drainage. On day 10, actually the wound starts to look a little smaller, and there may be a little sinus tract on the periphery, and as time progresses, that the sinus tract disappears after treatment. This is day 13, and in day 24, that again there's contracture of the ulceration, and the wound is getting smaller in size. And the bottom picture on this slide shows the amount of maceration. Patient also was applying Silvadene cream and doing warm saline soaks on a daily basis. And now you can really see the difference of how small the ulcer is getting, and the amount of drainage has decreased at day 31. Day 34, smaller in size, minimal drainage. Here we go in 38, day 51. It's almost completely closed. And finally, at day 69, complete closure with just hyperkeratosis. My second patient here is a 45-year-old male, type 2 diabetic with retinopathy, presented with a linear ulceration of 6 months duration, and it was at the base of the 5th metatarsal. We recommended contact casting by his previous podiatrist. The patient still couldn't work for a period of 6 months, so I gave him the option of using Silvadene and surgical debridement on a weekly basis, plus the use of diode lasers. As you can see, it's a pretty nasty type of wound. And you can see from day 5 that the drainage amount prior to treatment on the gauze pad. Again, the area looks dry at day 5. Day 11, and again, you have to debride the area on a weekly basis, minimally. And here we go to 25, and day 35, it's getting so small. And day 46, there is minimal drainage noted on the gauze pad. That was from overnight usage. And finally, it's almost completely closed at day 56. Next study is actually the same patient on the opposite foot, which was a Charcot foot, and the patient was wearing an Arizona brace. This is not the normal weight-bearing area that you get the ulcerations, and it probably was due to irritation from the Arizona brace. So we gave him the option of using the laser as a treatment. And if you look at day 7, look how small the area got. It was an amazing improvement. And there we go. On day 17, day 28, there's almost no drainage on the gauze pads. And by day 38, complete closure. The next study is not my patient, but one who had a cyst removed from her ankle. And there was wound dehiscence. The doctor didn't decide to do anything and just told the patient to wait. So the patient contacted Burman Laser for treatment, and you can see the second day that it starts to look better. And this is without debridement, I assume, at this level, since this wasn't my patient. And on day 8, it's getting cleaner and smaller. And here we go in different days. And day 25, looking clean. And by day 33, almost completely closed. The problem with this area is that there's a lot of motion at the ankle, and it delays healing. Now, I'm going to present a patient of Dr. Barbero in New York. And if you saw this patient come to your office, you'd probably say, contact the general surgeon for an amputation, or go to a vascular surgeon, see if they can do a bypass surgery. But on using the laser on a daily basis and surgical debridement, it's almost completely closed after 1 year. Changing course here and changing the head of the laser, we can use it to remove warts. So it doesn't matter what you use to get rid of the warts, but the insurance pays the same. So here's a picture of before and after treatment of warts. Most commonly, my patients come to me for plantar fasciitis. This Laser treatment can be used initially. I use it after conservative care fails. I have the patients use stretching exercises, cortisone and local anesthetics, and custom-made foot orthotics for my conservative care. Another reason that the patients come to you is for fungal nails. And I will show you how the laser before and after pictures on multiple patients. And here we go at 7 months, and there is a variation in time frame for treatment. Sometimes we offer the patient the initial treatment and we give the second treatment for free if they're not satisfied with the results. And you can see that the nail plate is almost completely cleared at the present time. For those people that do pain management or chiropractors who treat other parts of the body, laser can be used to treat pain in all the other parts of the body. And how do we really differentiate pain? We only take the patient's word for it. But by using the laser, we'll show you later with the thermography that we can actually see the pain. So the elimination and reduction of pain, the mechanisms of action engaged, the summary of light-induced analgesic responses include increased in beta endorphin, ion channel normalization, increased release of acetylcholine, increased nitric oxide production, block depolarization of C fiber afferent nerves, decreased bradykinin levels, increased nerve cell action potential. The elimination and reduction of pain restores patients back to their normal lives without pain. Summary of the light-induced anti-inflammatory responses include the following: stabilization of the cellular membrane, acceleration of leukocytic activity, enhanced lymphocyte response, enhancement of ATP production and synthesis, increased prostaglandin synthesis, increased angiogenesis, enhanced superoxide dimutase levels, stimulation of vasodilatation, reduction of interleukin-1, temperature modulation, decreased C-reactive protein, and neopterin levels. And here's what I was talking about before, a thermography showing the increased heat prior to treatment and after treatment. So in conclusion, the increased synthesis of ATP, RNA, and DNA, increased tissue oxygenation and nutrition, increased rate of tissue, nerve, and cell regeneration, increased lymphatic drainage, vasodilatation, nutrient transport, and increased range of motion. Thank you for your time, and education material is readily available. And if you have any questions, you can email me at harris.klear@gmail.com. Thank you.